Hey everybody, I'm Nasreen Khan, co-owner and esthetician here at the Vault Beauty Lounge and Urban Retreat in downtown Davenport, Iowa. Thanks so much for joining us today with Between Two Bridges, and thank you to the Downtown Davenport Partnership and the Quad Cities Chamber for putting this on. I'm honored to be a part of this video series, So today I want to kind of talk to you guys a little bit about some misconceptions about our industry, particularly about Botox and fillers. So I really want to focus on where Botox and where fillers fall into a normal anti-aging regime. I think here in the Midwest, we tend to be a little bit more conservative, and that's not necessarily a bad thing. But a lot of patients' fear can subside when you have enough education to know really what these things do and who's really an appropriate candidate and why. So we'll start with Botox. As we age, we've got all sorts of things that happen. We're going to have our skin kind of folding from overly expressing. We're going to have to deal with more dryness potentially. Some people become more oily with age. There's all sorts of things that happen to the structure of your skin. You tend to lose some bone density. You can also lose collagen, which is that nice structure that kind of holds up the skin. And another thing that happens is your skin thins. So everything kind of gets smaller in a way. The bones, the collagen, the muscles kind of lose some of that density. And also we have this thing called gravity that we have to focus on. So Botox is a little bit different from filler in that what Botox does is it's going to essentially stop that muscle from contracting. In my opinion, the Botox is going to be better from like the eye socket up. Areas like the forehead that when we're animated and talking, we'll have that muscle kind of scrunch and scrunch and scrunch. And all Botox does is it blocks that neurotransmitter. So the signal from your brain to that muscle can't happen. So instead of overly expressing all your life, creating that super deep crease, you're able to essentially atrophy the muscle a little bit or push pause on that muscle, so that way you're not going to have that crease form. It's not overly corrective, so early intervention is key. But let's just say that you have a line that needs to be filled. That's when filler would come in. So today, Terrie, our nurse injector, is going to be demonstrating a couple of different fillers on us. So this is, again, just my opinion. Filler can be great for everything from filling in a line that maybe we waited a little bit too long to do Botox on, or parts of the face where genetically you can't help where your bones and where your muscles lie. So the marionette lines that go from the nose to the bottom of the jowl there. Some people can't help how their face is shaped, and that's just a natural occurrence as they age. Juvederm filler is one of those hyaluronic acid fillers that's wonderful for filling in that region. Other areas that people use filler for would be to augment or slightly plump the lips. You can also use filler to do kind of the Kylie Jenner, which is, sort of like giving those plastic surgery-like results just using filler. But here at the Vault, although, Terrie is more than capable of doing that, that's not necessarily part of our brand. We tend to like to work on the everyday person, sort of just enhancing that natural beauty and enhancing the natural contours of their face. So some areas that we're seeing commonly would be, yes, a lip augmentation for sure. And it isn't just about cosmetics. So some people, as they age, that lip kind of turns in, and maybe they just wish that they had a little bit more of that lift to create less space between the nose and the upper lip. Another thing that happens is as you start to lose the fat in the lip, then the lips start getting more creasy and they look a little bit more dehydrated. So it's not always going to be about wanting to enhance, beauty or what the standard of beauty is in this country. Sometimes it really is about replacing the lost volume within the lip. On the topic of lost volume, in my opinion, that's where filler really is at its best. So as we age, as I mentioned, you're going to be losing some of that bone density. And so it's common for people to get more gaunt around the cheeks and the eyes. And so what filler can do is kind of replace some of the lost volume in the hollows of the eyes, so you don't have as much dark circling. I just happen to have, because of my bone structure, a little bit more hollowing under the eyes. I've had it since I was a kid. And so filler might be a great thing for me to do, depending on what the expert says. Filler would be great for me to do around my eyes, to just kind of fill in that hollow. And so that way I don't have as much dark circling. I'm not looking to change the way I look. I'm looking to just wake up naturally looking a bit more refreshed, a little bit more well-rested, a little bit healthier. Another area that filler is great for, and this is, again, you can overdo it, sure, but when done tastefully, doing a little bit of filler on the cheek can actually just add a brightness. And what you're wanting to do is not add a ton of volume to change the way you look necessarily. It's really about replacing some of that lost structure that happens when we age. We lose hyaluronic acid, which is in part some of the cushion in our skin. So today, Terrie is going to demonstrate some of what the filler is going to do around those given areas. Because again, as I said, even at age 35, I've noticed gravity kind of taking its effect on me. I've noticed that, sometimes when I don't get enough sleep, I feel like the face kind of hangs a little bit more on those days. And we have these things at our disposal. They are safe, they are effective, they are quick. The results are almost immediate with little to no downtime at all. Risks are extremely low, and I can kind of not give away my secrets of maybe how little sleep I've had with a little bit of filler. So on that note, this is Terrie Frieden. She is our nurse injector, and she's going to take it from here, demonstrating some of the things that she would do on my face, for example.
Okay. All right. Well, obviously Nasreen has a very beautiful face. And so we're just, like she said, we're just going to enhance it a little bit. We have done a little bit of cheek filler on her a couple of weeks ago, but we noticed afterwards that she was a little bit uneven. And so now today her left cheek is a little bit fuller than her right. So we're just going to enhance this just a little bit. And I'm going to put some markings on her, and then we're going to inject her to get her nice and even. And then we're going to do maybe just fill in a little bit under the eyes, just filling the tear troughs with a little bit different filler. So
that's another thing too that I forgot to mention. There are different fillers for different parts of the face. So Jupiter Voluma, which is what I had for training purposes put into my cheek a couple of weeks ago, that's a 2-year filler. It's a little bit more dense. So the cool thing, and this was new to me, I've never experienced this or had seen it done before, which I'm fascinated by. Once it was injected, Terrie really gets it and she molds that filler. And I was really impressed by that because the injector, if they're experienced, has a lot of control over making sure that you don't end up with a bad outcome. And as far as being uneven, we were doing this for like totally a training purpose, and we intentionally reserved a little bit of that filler so that way in that 2-week period, once things have fully settled in, you can go in and find the little area that may just need a slight adjustment, and that's a way to guarantee that you're not going to have a bad outcome.
Okay. All right. So what we're going to do, and I want you to try to hold your face up as. So I'm just going to put some landmarks here. I'm going to put some markings. I'm going to draw a little roadmap on her. So first thing, we're finding the apex of the cheek. And we do that by doing a perpendicular, just a vertical line here. Then we're going to go from mid-chin, go right across the lip, and where these two intersect, that's going to be our starting point. And if we do this to both sides, find those landmarks, then we know that we should have her cheeks pretty good. And I know that we did that before.
Mm-hmm.
We're going to put a little bit like right here. Okay. All right. So you ready?
I'm ready.
And we've washed her up. We got her nice and sterile.
Yes.
And so now we're going to inject.
So every injector is different. They have their different technique, their different protocol, all safe, of course. But one thing that I love about Terrie is that she so cares about how the patient is going to feel. She wants them to have that really gentle experience. I opted out of numbing. Efficiency is my love language, so I was like, let's just get in there. I'm okay with it. But you do have the option of being numbed beforehand.
Okay. All right. So, Nasreen, we're gonna go. Okay. Here's the first injection. We're gonna go right in.
So I'm going to tell you right now. At first, I was like, "Is that Botox?" Because it didn't even hurt at all. It was like I thought that was a Botox needle. It did not hurt at all.
And if we pull up on the skin here just a little bit, it'll actually help lift in areas where we want. We're actually putting this filler deep and right on the bone.
She's so gentle.
Nasreen, we have our first question or just a comment about from Frank, who says Botox fixed his tension headaches that were caused by his eyebrow. He had a hard time unfurling. So do you want to talk about how maybe he says it made him extra handsome? Other benefits, like he mentioned headaches. So are there other benefits that people use this for?
That's such a good question. And Terrie would certainly know a lot more about that than I do. So that's the thing about people's fear around Botox. Botox has been used really as a medical product to treat conditions, I mean, for a long time. You know, in the 80s, I think in Canada, they started using it for cosmetic reasons, and then the US followed shortly after that. So yeah, tension headaches, sweating. So like people with hyperhidrosis can get injections in their hand because again, it's kind of in a sense like, again, forgive this really lay language, but it's kind of like a nerve block, like you're preventing that neurotransmitter. So if you have, you know, a signal sending too much sweat to a region, you can essentially block that with Botox. So yeah, tension headaches, migraines. I know a few people with autoimmune conditions like myasthenia gravis who were getting Botox for, yeah, like muscle tension as well. Anything else? Like sweating, you put it in your armpits?
Yeah. Oh, yeah, I know they're finding more and more uses.
So many more
Botox.
uses, yeah.
Yeah, so many, there's a lot of off-label things.
Mm-hmm.
But yeah, tension headaches. People will commonly notice that their headaches are much better, or they don't have as many of them when they do Botox. And then they know that their Botox is sometimes wearing off because they start getting those headaches again.
Mm-hmm.
So that's how they know that it's time for Botox again.
I'll tell my own story. I mean, yeah, this is my industry. Mine doesn't have to do with headaches. I just because like just my bone structure, we have thin skin in our family. At age 27, I started getting a deeper line here, and I'm like, well, that sucks. And I started Botoxing, and I remember I was pretty like shy about it. I just felt like I would be judged. But the reality is that here at 35, I was able to do something a couple times, 3 times a year, you know, minimal cost, very low risk, if any, for me. And now I'm able to kind of, I'm trying to think how to say it. Without Botox, I would have fallen in the footsteps of everybody else in my family with a similar bone structure and genes, that we would have had a deeper crease, and it's avoidable, so why not? And again, it's less like, yes, there is a standard of beauty and we're all aware of it, but for me, so much of how I approach the skin with facials, because I am an esthetician here, it's really about age management, just knowing what are the things that we're up against that cause aging, whether it's early cell death or gravity or loss of that bone density, as I said. And okay, that's just a fact. So what's the reality? And then what's the solution? So that's my approach. It doesn't have to be shameful or emotional. How are you so gentle? I don't understand.
Do you have a mirror in here?
I do.
Okay.
Second drawer. So I used to be needle phobic, full on nervous breakdown, out of body, like sound the alarm. And I think that getting injections like Botox, it's got me over my fear of needles. And it's gotten me over my fear of other things that are painful too, because I don't honestly I think I have a baby, and that did not hurt at all.
Okay. Good. I always like to get the patient's input, so
I think
I
it
want
was
you to
wonderful.
look, and then I want you to tell me if you feel like it looks higher or lower?
I don't know. I think it looks great.
I know. Do you feel like, I know the lighting is maybe, just not optimal. Do you feel like you need a little bit more right here?
I honestly think when I look at it, because I'm the one that can kind of look at these two angles.
Yeah.
Because of filming, we're a little bit backed against the wall. Like maybe just the littlest bit, like right in there compared to the other side.
Okay.
That's it.
Okay. Yeah, it's amazing what fillers can do. Fillers are my favorite thing to inject, I think.
And they get such a bad rap because I think so many people, maybe in Hollywood, who probably have some kind of like facial dysmorphia, they probably overdo it. And that gives it such a bad name because really, when you see the celebrities that you think, oh, they're my idol, they're aging so gracefully, trust me, they're filled. They're filled. They're just not overdoing it.
So I'm going to put a little bit more right here.
Okay. As I mentioned before, there are different fillers to do different things. So this is Voluma you're using.
This is
So Voluma is actually, it's a 2-year filler. And by the way, filler is made of hyaluronic acid, which is a naturally occurring compound in your body. It's what gives skin moisture. It's what kind of keeps the structure up, gives it density. It's also what cushions the joints in your body. It's a water retainer, essentially. So how it works is we inject the hyaluronic, and then it kind of pulls water to the area. That's part of how this works. And your body will just eventually absorb it. It is safe. And the Voluma that we're using, the cheeks, is a little bit denser of a filler where you don't want it to be as like malleable. So you want it to really stay where it is. And this one's going to last about 2 years in the body. Now, other ones where you don't want it to be as sturdy, say what, like marionette lines, is that one that you use a softer filler. The softer fillers, you're not really going to feel them once they settle in. And those last, what, about a year, would you say?
Most fillers last about a year.
Yeah. Lip filler, when you do a little bit of a lip augmentation, those ones, again, after about 2 weeks, they start to settle in, the water draws closer, and they tend to hold that structure in your lip for about a year. But those are a softer filler because you don't want them to be overly stiff. So, you still want to be able to look natural.
Okay. So are you, if you think that we have your cheek good now,
looks good to me.
and then we'll recheck it in about a week too.
Yep.
Because at first you always have a little bit of swelling, and that needs to go down. You got the needle trauma,
Right.
And then the filler is going to absorb a little bit of water. Some absorb a little bit more water than others. And there are fillers that will last even up to 5 years, but
Wow.
Voluma is a really nice one. The Juvederm family, they're very nice, especially for like new filler users. Because most of them, they're going to be gone in a year.
Yeah. And that's like another thing is you have to be careful with where you're going because some places may use off-label fillers or things that aren't actually like FDA regulated. Juvederm, any product by Allergan, I think is just so tried and true. So I would trust them for sure. These multi-billion-dollar medical device and research companies, they've got so many years of research backing everything that they put out. So rest assured, you're not getting something like shipped in from who knows where.
Yeah. Where you don't know how it's been stored or.
Right. And you just tell me how you want me to write.
You're perfect. You're perfect right there. So we're going to do the tear troughs, and some people do this a little differently. What I'm going to do is we want to go kind of deep, and then we're going to, I like to make as few injections as possible. So we're going to go down here, and I'm just going to kind of navigate your cheekbone.
I don't understand how this doesn't even hurt. It's crazy.
Okay.
Terrie, I think you could probably answer this question. Lori wants to know, does the client decide where to use the Botox, or do you help with that decision? So maybe talk about when a client first comes in, what the pre-appointment kind of looks like.
Yeah. So if someone has never had Botox before, what I like to do is I like to make a suggestion to them and say, this is what I would do. Of course, it's always kind of based on their budget too. And so then I just tell them, okay, this is what I recommend. And then I like to document that too, so that when they come back, and maybe they're not, they're usually pretty happy, but if they're not, then I would say, okay, then this is, I think that we need to maybe do a little bit more. The other thing is, if someone has had Botox before, a lot of women know exactly how many units they want, and
Like me?
yeah, and where they've had them, and I welcome that. I like that. So you just tell me where you want it, and I'll put it where you want it. And
you know, Terrie's just so experienced, and I'm like, she's so good about how I can't believe I didn't feel that. She's able to then kind of look at the client and tell them what's realistic and what are they asking for, and
right, especially in the case of lips, sometimes people can be a little bit unrealistic.
God, you're good.
You always want to make sure to get it nice and smooth. You don't want any lumps or bumps. Although the beauty of this filler, this is actually Juvederm Ultra Plus, and it's not quite as hydrophilic. It doesn't have as much of the water grabbing properties as some of the other fillers. So that's why it's probably one of the better choices for under the eyes, because this is a place where you can, the wrong filler, you could get a big water bag very quickly. You have to be really careful. You want to do just small amounts.
The injector matters. It matters who you go to. Yeah. I have to be honest with you, I've never had such a gentle injection in my life.
And of course, you have to be very careful around the eyes. I'm on the bone, and we're staying outside the orbital rim. Small little aliquots of filler.
So I'll be honest, I've been curious about this one for years, but I was so petrified that it was going to hurt really badly.
Oh,
I can't, and that's why, I can't believe I'm really shocked.
All right, I have a question for you guys.
Great.
Frank wants to know, how long do you recommend until you can get back to working out or doing something where there's heavy contact after treatment?
yeah, so that's a good question, Frank. it takes about 72 hours for this filler to set up to almost to the consistency of like a gummy worm or a gummy bear. If you do heavy exercise before that, then when you increase your circulation, you increase metabolism, and you could actually metabolize part of this filler before it even gets a chance to set up.
Oh.
So you can take a break from your workout tonight, Nasreen. That's what I heard.
It's an excuse. Yay!
Yeah.
I love it. Just tell me how you need
Yeah.
it on my face.
And I don't think that we would put any more in there for now. Can you see a difference though?
I totally
Nasreen,
can. It's crazy. Yeah.
It's really subtle.
Yeah.
Yeah.
And it, again, like these are all things where it does matter who you go to, because some injectors, they can just go buck wild and they have that look that they really like, that's overly filled, overly done. I mean, it's same with plastic surgeons. Some plastic surgeons, they favor a really fake look that somehow the disparity between start and end is really, they like that. But what I love about Terrie, I mean, one of the many things I love about her is that her taste, it's just, she's so tasteful about it. And I may be a less than ideal example for who is suitable for filler, although I will say, like, I haven't been wearing makeup ever since I got a tiny little bit in my cheeks a couple weeks ago, because I it's crazy. I know I just don't even have to wear makeup anymore. But as people age, this just all ties in with everybody's anti-aging routine. You know, you do the skincare treatments day in and day out at home, the skincare products all day, every day at home. You know, that's important. It's almost like working out with a trainer to get the professional equipment versus eating properly and sleeping and water intake at home. That's kind of how I think of facial treatments. Is you do the legwork at home. That's a big part of it. You have access with me to the things that you don't have access to at home, like chemical peels, the machinery, microneedling devices, lasers. And then of course, these kinds of things like filler are part of a grander plan, which would be, let's start replacing some of the lost volume and the bone density. Let's kind of get rid of gravity, because there ain't no skincare from home that's going to defy gravity. There just isn't. So that's what I love about how all these things tie in synergistically.
Yeah. Okay. How do you feel about, should we just kind of show them other places to put it? Like maybe because you've got a little bit left, we could just put just a ever so small amount there? Or
and that is an area that, you know, I naturally, just because of bone structure and probably dehydration, you know, that this is an area that was the first place I started seeing signs of aging on my face. Was all of a sudden I have a line there. I'm like, huh, okay. So do you want to do some early, should we do some early intervention today, guys?
Sure.
Why not?
Okay.
You just tell me how
And
you
we're just going to do it really soft. You don't want to put too much here because it will look really unnatural, and you can, let's have someone looking like a monkey.
I'm kind of stunned. I don't feel anything.
Yeah, and you're not bleeding at all. A lot of people won't.
I'm not even just saying this, guys. Like, I'm a baby. I am such a baby. I don't like the most minor of inconveniences, and I don't even feel anything. I'm shocked. Good job, Terrie.
And sometimes it's really amazing, and just the tiny little bits that you can do that can really make a difference. So many people, I think that they know they need something, they think they need filler, but it has such a bad stigma as it's going to be, you know, so expensive and they need so much.
Mm-hmm.
But
yeah.
Cost really, and because of competition these days with the different filler companies, it's really the cost has stayed down. And if anything, some of them have even decreased in price.
Mm-hmm.
Really don't have anything down there.
And it's all relative, like that whole expensive price thing. You know, you could be tinkering away at your skincare regimen for years, having this goal of like, I really want to lift this area, but that's impossible. So it's just kind of really knowing that what is the goal, and then what are the viable options to get you to that goal. Because, you know, I tell people all the time with the forehead lines, I'm like, and I do facials for a living, and I'll say, facials aren't it. No matter how much you do a facial, you're not going to get rid of that line. You're not going to prevent that line from happening, because that line is happening from a muscle contraction going like this day in and day out. It's like folding a piece of paper over and over again. Eventually it's going to have that hard crease even when it's opened up. So, you know, it's just understanding from, you know, the professionals where these things fit in.
Okay. And so because we have just a little bit left here, we're going to do one other thing on you.
Okay.
And you're going to tip your chin down. We're going to go back and we're going to inject just on the angle of your lower jaw. And it's actually can help pull back a little bit.
I didn't even know that. I have a question about the masseter, Terrie.
Mm-hmm.
So this is a common area that I see getting Botox injections, is this muscle right here. I don't really have an issue with using my masseters too much, but some people have a really, they get that really square jaw from kind of clenching. Botox is what you can do to kind of soften that masseter, right?
Yeah, you sure can.
And that can contribute to headaches and TMJ in some people, and some people just do it for cosmetic reasons. Oh yeah, sorry.
No, it's okay. Yeah, masseters are becoming more and more common, especially there's the teeth clenching, like at night, and grinding the teeth. It's a condition called bruxism. But if you just inject those masseter muscles, they're the ones that are used for chewing, you actually grab onto it and then just inject about 15 units in each side. That's going to relax that. And so people love it, and then we'll come back every 3 months to have it done again, because you can get headaches, and you can really get, you know, pain in the jaw from doing that.
Mm-hmm. That can transfer down to the neck, all sorts of things. Neck pain, yeah, just.
Okay, that's it. That's up to that. Let's see. Let's see her eyes.
Yeah, it's really fascinating. And I think that that's something that was a challenge for us at the Vault before. You know, we have many clients, and our goal is to have their back and to deliver on something that will enhance their life. And it was hard, you know, having people that are coming in and they have this goal, they have things that they're less than satisfied with, and to not have been able to help them before was hard, because there are only so many things I can do with my license. But now we really have this beautiful synergy between, you know, like what Terrie does and what I do, because I can help people with the health of their skin, pigmentation, the quality, texture, things like that. And then she's able to really go in there and, gosh, make these subtle transformations. It's like, I love the look of, I can't quite put my finger on it. And that's what I've learned filler does. You know, I admit even a couple years ago, I was sort of like, I'll never do that. Because of that stigma, or thinking that somehow it was a character flaw. But really what I have learned, especially as I'm aging and as the clients I've had for many years everybody's aging, you know, not aging backward, that it would be nice to have something an answer to those things that kind of burden them day in and day out.
Yeah, and these are things that you can just do over time. And a lot of people I tell them, you don't have to do everything at once.
Yeah.
Just come in and do something every 6 months. Mm-hmm. And more people are opting to do these sorts of treatments than plastic surgery.
Yes.
So plastic surgery has probably really gone down.
I
There's so many other things.
actually want to look at those market studies because I know that like for our industry, day spa, we're going more medical because that's the trajectory of the market. But I would almost venture to guess that people are veering away from some plastic surgery. Now there are some, I'm sure, surgeons in LA or wherever that do these specialized kind of like minimal downtime treatments, lower lifts, whatever. But what I love about filler and Botox is you can do some things that are surgery-like with the outcome, but you're in and out in 30 minutes and you go on your merry way, and that's it.
Yeah, a lot of these are lunchtime treatments.
Yeah. People have to work, I know, majority of the clients that we see here, they're working women and men, and they don't have the luxury of managing their age or, tending to their health. If the trade-off is they have to be down for a week, people just can't really afford to do that. So I love these kinds of in and out procedures where it doesn't interrupt your daily life.
Yeah. And there are very few side effects of these. And I know Nasreen was talking about these are hyaluronic acid. But it's synthetically made in the lab so that there are virtually little to no possibility of having an allergic reaction. Mm-hmm. So they're very safe. Yeah. Very safe. Of course, with all all fillers, there can be some complications, but if you know what you're doing, those risks are minimal.
Yeah. How long have you been doing this, Terrie?
17 years now.
So there's that.
I have a couple other questions for you. Is there a procedure for jowls? Is that your neck area or something?
Jowls, yeah. Well, gosh, Terrie, I can make recommendations. She's really the pro. We have something that we're bringing on in January. Shh, just look out for it. But that would be a great thing for jowls. But Terrie, I want her to talk about Pdo Threads because this thing it's like a godsend. It is surgical-like results without surgery. Because when you have that gel, a lot of people can't help it. It's not that they've done something wrong and they're like, it's just their bone structure, tissue, where everything hangs, how thick their skin is, and it just forms in a jowl. And Pdo Threads are a non-surgical way, you're in and out, to actually pull back and tighten the region. Those are surgical threads, so they just dissolve. And the result is about 3 to 5 years of result, is it? Or
maybe it varies from person to person because we're building collagen. When we put these threads in, you instantly start building collagen around it. So then you have to kind of go back to what broke our collagen down in the first place. What gave us the sagging skin that now we need threads? Free radicals, byproducts of sun, smoke, pollutants, chemicals, stress. All of those things cause us to release enzymes that break down the collagen in our skin. So the more that you can take care of any time that the threads are like these other things are an investment. So when you make that investment, you want to take care of that investment. And you want to wear sunscreen, avoid sun exposure, avoid tanning beds, all of those things that break down our collagen. But Pdo Threads are wonderful. This is something that was amazing. The threads were available back in the, I think, early 2000s, if not late 90s. But the threads were not very good, and they would break easily. And so then they went off the market for a long time. And then they've just kind of reemerged, maybe in the last, 5 or 6 years. But they're doing, just going gangbusters.
Yeah.
They are, it looks like the lifting threads, the heavy lifting threads, look like a piece of fishing line, and they have little teeth in them. And these teeth are what, when you put these in, they anchor. Yeah. And so the teeth are like this little barb on a fish hook. Once you get them in one direction, you don't pull them back out. That's how it lifts. So these threads can come in, I like to use the ones that are pre-loaded in a cannula, which is just a big needle. And so I always have a consultation with the client, and we put just with one finger, we kind of look and see where that client is gonna looks the best. And so then we'll draw some lines going from this main entry point down across this nasolabial fold, then another line, and I draw these with a red Sharpie so that it doesn't come off. And then I go right underneath the lip to help pull that corner of the lip up.
And then the gel.
And then the gel, yeah. And then, so 3 threads kind of going from the same entry point.
You know,
yeah, go ahead.
No, I just say and those things can also be done on the neck for people that have neck drooping, or they're starting to get that. Women, it's a female thing. This is one of the first places that kind of starts to show our age is we just lose a little elasticity. It isn't a double chin, but Pdo Threads, you can, again, this is with one little needle poke, essentially, much like the filler, and you just draw those threads back. The famous thing we see on Instagram is Bella Hadid, her transformation with those like beautiful fox eyes. Those are that's all Pdo Threads. So again, age management, but also you could do them for cosmetic purposes too.
Yeah, and so we can give you those fox eyes or cat eyes, and then we can also put them, kind of grab that muscle right underneath the brow, but we can do a brow lift and just kind of even shape a brow. Or if someone has one brow that's lower than the other one, we can actually put those threads in here, kind of go up right into the hairline, and then they just stay there. Get them nice and tight, and they will just stay there. You
would think it's like surgery, but you're in and it's out. It's one little needle poke, and I mean it's nuts.
Yeah.
It's nuts.
Yeah.
Topical anesthetic, is that right? Some topical, maybe?
We might want to inject a little bit because we want to use a little bit of lidocaine that has epinephrine in it that constricts blood vessels, so it minimizes the risk of bleeding and bruising. And that's what people like. That's what people really like.
Yeah. People almost like, especially here in the Midwest, they don't want people to know that they've had something done. You know, people are shy, and gosh, if you had something done and then you have to go to work and everybody knows that you were beat up, that's not a good thing. But on the upside, if you are one of those people that's apprehensive about potentially bruising, what that might do to, your reputation, we're all wearing masks now. I can't think of a better time to do this stuff than in a pandemic where we're all masked up every day. So,
yeah, a lot of people are doing a lot more things than they've ever done before because they can hide behind that mask.
Certainly, yeah, certainly. But I will say though, I'm not new to these types of injectables. I've never bruised with Terrie. Not saying that I couldn't. There's blood vessels everywhere in your face, but other injectors, I've always had gnarly bruises for weeks, and I've not once ever bruised once with her. It's crazy. I don't know, guys. I'm just saying. Yeah.
All right. So the last question, and I'm sure this is a range. Talk about, do customers pay per area? Is it by product? Can you work within people's budgets? What should they anticipate coming in?
That's such a good question. So a little bit of everything. So basically how Botox works is you pay per unit. And I would say the average range would be between 35 and 50. Yeah. Some people could get by with 26. Some people may need a little bit more, maybe if they have a really large forehead. So you pay per unit. With Juvederm, you buy the whole syringe. But a syringe there's not that much. I mean, you think that it's this huge amount. I think that 5 full syringes fills up a teaspoon,
Yeah.
So it's really not that much. And so I think that's where Terrie can tell people, what's your dream list versus what's a more practical approach to this. Because we all have I want everything. But, again, once we understand that things are material, there's prices to them, she'll work with you to discuss kind of what that would look like. And as she mentioned, it might not be that you do your entire dream list in one day. Sometimes it's a series of these things because you don't want to not look like yourself. And sometimes it can take a few sessions or, over the course of several years to really get that look that you're going for. That way you don't wake up the next day not looking like yourself. Yeah. But yeah, I mean, as far as working with people's budget, if there's the end goal and that's something that you're really sturdy on, then that's going to, the price is going to be determined by what that end goal is. But Terrie's really good at working with people to take that more practical approach.
Yeah, we work with budgets all the time. But typically, if someone comes in and they say that they have a budget of $200, we're going to focus on treating an area that really bothers them the most. We don't want to like spread that $200 because basically that's just 20 units of Botox, and that's not very much. Say, for example, we're talking about Botox, but you want to get an area looking good. And then they can maybe come back another time when they've saved a little bit more money. And then we can work on another area, but concentrate on the areas that are of importance to them.
Yeah, full disclosure. And again, this is me, this isn't you necessarily. Like when I was 27, I got Botox for the first time. I'm pretty sure we did maybe 27 units, and I got it at a discount when it was $10 a unit. So my bill was $270. And I did that 3 times a year. With filler, the volume is a little bit pricier, but filler, I think that's an $800 filler, but it's a 2-year filler, which is great. The ones that you're going to see more commonly used around the face, those are about $650 for the syringe, right?
Yeah.
Yeah. And the vault is running a special, through the end of the year. So give us a call if you're wanting to maybe get some filler done, and look out for more promotions because we do want to make these things accessible for a broad audience in our community.
That's all the questions. So
Wonderful.
Thanks so much.
Thank you, Terrie. I hope you guys learned a lot today. I mean, even I learned way more than I had bargained for, but thank you so much for tuning in to Between Two Bridges. We love being downtown Davenport. We love the Quad Cities Chamber. We love the Downtown Partnership. Super fortunate to be a part of this. And again, we hope that you guys leave here having learned something and leave here mostly what I would love for you to know is that there is no need for stigma associated with these things. These are just part of what I call, I have an appointment with Sam, Smart Age Management. That's it.